Hi, I'm Dr. Mike Blaney, and today we're going to talk about a common question that I get asked, which is how much weight should I expect to lose after weight loss surgery? Sounds like a simple, but this is actually a very complex answer to a simple question. And the answer is it depends. It depends on a number of factors. These are issues that you can't control, such as your age, your starting weight, your sex. Men tend to lose more weight than women. Younger individuals tend to lose more weight as a matter of percentage of their excess weight than older individuals, and a lot of it really just depends on genetics. So we can't worry about the things we can't change, but what we can change is our behavior, and we know how tough that is anyway. So ultimately, the amount of weight that you're going to lose after weight loss surgery will be a direct relationship to your behavior, and that's the behavior of eating and the behavior of physical activity. So in our program, we coach our patients throughout their pre and post-operative journey on healthy eating and changing behaviors into a healthier lifestyle. So the way we compare individuals to one another after weight loss surgery is expressed in terms of percentages of their excess weight loss. So let's say, for instance, we weigh 250 pounds and our goal is to be 150 pounds and want to lose 100 pounds. So if we lose 100 pounds, then obviously we've lost 100% of the weight that we would like to lose. If we lose 50 pounds, then of course we've lost 50%. So that's how we as weight loss surgeons think of ultimately the results after these procedures. And what I'll typically observe is that most individuals will lose about 20% of their excess weight in the first 6 to 8 weeks. So for that patient that needs to lose 100 pounds will probably lose 20 to 30 pounds during the first month and a half after surgery. Typically that number will double over the next several months, so about by 4 to 6 months an individual will have lost about 40 to 60 pounds, and then generally over the next year the patient will lose the rest of that weight, hopefully achieving 100% excess weight loss. And most of the time this will be achieved in our lower weight body mass index patients. So for instance, an individual who has a body mass index around 40 who might be considering a sleeve gastrectomy or a bypass will probably come pretty close to losing 90 to 100% of their excess weight. As an individual's body mass index increases, let's say to somewhere in the range of the upper 40s or lower 50s, we expect those individuals with a sleeve or a bypass to lose about 70 to 80% of their excess weight. Then as individuals' body mass index starts to get well into the 50s, or particularly over 60 body mass index with a sleeve or a gastric bypass, an individual will probably lose about 50 to 60% of their excess weight. Now this is still a lot of weight loss in terms of absolute numbers, but many patients who have a body mass index at a heavier weight range will probably still end up with a body mass index over 40 if they have a sleeve or a bypass. So in our practice, this is when we start to consider a patient a candidate for a duodenal switch in order to have more effective weight loss and hopefully at the end of their weight loss journey end up with a body mass index in a more medically safe weight range, which I guess I would generally define as hopefully a body mass index under 30 and definitely under 35. So again, you know, these are all generalities and everybody's results are different. That's going to be influenced by things you can't control, such as genetics, your age, your sex, but also influenced by behavioral factors such as the food choices you make and the activities that you engage in. So I hope you like this video. If you did, please subscribe to our channel below. Please remember to turn on the notifications button so you get notified when we publish other videos on our YouTube channel.